Yes, we need to double finance adaptation. Access is going to affect resilient health systems. So while waiting on my slides, we need to be very healthy, and you know that climate change is affecting everything. Our very... Okay. Anyway, we'll not wait on this slide. Our very existence is being affected by climate change. And as introduction, access to energy is a critical component of a resilient health system.
Point to this side if you want to do it because the computer is over there.
Where is the computer?
Don't talk in the mic.
This one. The technology is not working. Access to energy is a critical component of a resilient health system. Energy is essential for powering medical equipment, maintaining proper lighting in healthcare facilities, and ensuring clean water. We have to define our terms. So the type of energy that we want renewable energy access. And we are talking about resilience. Why resilience here? Resilience is a capacity to fall back after a shock. What are we actually talking about? We are talking about climate shock, because everything is about climate change. Now in our environment, we'll see that over the years, we have been able to manage and cope. But when we have a climate crisis, for instance, we have a heat wave, how do we cope? To start with, what is a health system? When we talk about health systems, we are not just talking about a hospital or a health center. A health system is a collection of people and organizations whose aim is to maintain the health of people. So we talk about people, organizations, whose action is to work together to make sure that people are healthy. And there are some very important components of the health system. I've noticed that many questions are coming up, how do we do this, how do we get the finance? And I think that by using the components of the health system, I'll be able to answer some of the questions that might come up. The first component of the health system is the leadership and the government. The second one is health service delivery. The third one is health finance. You see that you will see finance almost everywhere. The fourth is the health workforce, and then the medical products, vaccines and technology, and health information. You agree with me that if we take something like health service delivery, that's when we are going to talk about a hospital. In the hospital, there is nothing you can do in the hospital without energy. And we don't just need energy, we need reliable energy, we need sustainable energy. Take, for instance, a situation where there's a climate crisis, and then people are running to the hospital. Let's take, for instance, a flood, and you don't have energy, or your solar systems are not working, or they are epileptic. That's why we are talking about reliability and sustainability. The first thing that will happen is that you will not be able to even see who is coming. So it makes you triaging the patients very difficult. It's very practical. People are running from somewhere and they're coming for help, and then you are not even able to see the people just because you don't have lighting. Now, if you are even able to get a little bit of lightning to be able to triage the people, there are some people that will have just cuts that you need to suture. There are some people that need to go to the operating room, and in the operating room, your equipment cannot work. I don't want it to be too much of academia. I want it to be practical so that we can look at it in our minds, and then we see the challenge that we have. We see the importance of the energy access to our health system. And remember, we are our health. Without health, you can do nothing. Now, it brings us to the fact that you need energy access to run equipment in the hospital, just from this scenario that I'm talking to you about. Now, if this equipment are not working, you can't do an X-ray, you cannot do ultrasound, you cannot even administer care. So it's going to compromise the quality of care and care outcomes. If a patient is in the intensive care unit, for instance, that patient is monitored by machines, and there is no power, of course, the patient is going to die. So even when you have the experts to deliver care without energy, you are not going to have the care done. Let's look at the case in the remote area. And you will see that government policies, you and I, the youths, the researchers, have not put statistics on the table for the decision makers to be able to take decisions. That's why you see that energy does not get to some remote areas. I don't want to talk a lot on energy, the energy delivery, because there have been a lot of presentation. Even the one Prof just did, it was all about energy transporting equipment and stuff like that. Because even those of us that are in the urban areas, the situation is a little bit better. If you look at people living in the remote areas, theirs is worse. In Cameroon, for instance, how many solar-driven refrigerators do we have? I think two for the whole of Cameroon. One is owned by the system where I work, and the other one is owned by the government. Only two. But how many remote areas are there? We are talking about the indigenous people. You can see a pregnant woman that wants to have a baby, and because the baby is malpositioned, the patient needs to go for a surgery, and you get to the hospital and there's no light. Let's assume that we can manage to do that cesarean without light. But if it's a complicated case like pregnancy-induced hypertension, and the patient is convulsing, there is nothing you can do. You watch those two lives go, because you'll be afraid that the person might aspirate, the patient might aspirate, the woman might aspirate, you don't have suction, and even if you succeed to extract that baby, you don't have the equipment to keep the baby warm and provide all the necessary health care that you need. That's why when we look at it, we should not look at it from the urban perspective, we should look at it from the indigenous perspective, the remote areas, what happens there. When the former presenter was talking, he mentioned the case of COVID, and vaccines were supposed to be stored at very low temperatures. COVID was not only in the town, it was also in the villages. How do we get this energy? But it's very sad that we are suffering all of this, and Africa is very rich with renewable energy. We have the sun that you can even extract it even in very humid, when the weather is still humid. But we cannot extract it because the governance, it's not backing us up. We have to say it here. We are youth, and we are here to learn, to be able to drive it forward. Now, when you go to the government will tell you that they don't have statistics. And then the patients are dying. We cannot deliver healthcare services. So what do we do? Even when some communities try to have renewable energy, the energy is not reliable, it's not sustainable. We talked about the lithium battery, the previous presenter, that has a very short half-life. Imagine your energy plant in a cottage hospital, and then when you want to use it, your battery cannot work. It's so frustrating. It's so devastating. So that's why we have to look at it very keenly and very seriously. Clean energy efficiency benefits human health Now, when I was talking about the pillars of a resilient health system, I talked about the energy workforce. Now I'm talking about us, somebody who is healthy. You live in an environment and you don't have access to energy. If it's very hot, you are not even going to have a good sleep. Mentally, you are not stable. And you are expected to deliver care to people who are sicker than you. Because when we are talking about health, we are not talking about absence of disease. We are talking about general well-being. So you can see how energy is access is affecting the resilience of the whole health system. Now, when we come to things like vaccines and drugs, where do we store them? You see, there is a lot of vaccine failure. There's a program now that is trying to identify children who do not have access to vaccination. And some of us in Central Africa, when you look at your hand, when you had BCG, you are supposed to have a swelling. Some people had BCG and they didn't have that swelling. What has happened? It means that the strength of the vaccine was not good enough to initiate that reaction. So that is vaccine failure. That's for vaccines. What about some drugs? We are in Africa, especially people in the remote area. If you have a snake bite, you need anti-snake venom. And those medications are life-saving, and they are kept in the refrigerator. So what happens to somebody in the remote area that has a snake bite? Of course, if we cannot use our indigenous practices, like some people use black stone, there's a lot of things that is done about that. You watch the person die. What about medical technology? It's not only abroad that people come and tell you that I wrote that if I'm in a very bad condition, you should let me die or you should resuscitate me. People are also doing that in Africa now. So how do you keep your electronic records if you don't have energy? Somebody comes to the hospital or the family feels that you didn't do something right and they want to see the records. And just because you don't have energy, you cannot get that record. You are going to, first of all, traumatize the person. You yourself, you are going to feel traumatized. You are going to feel frustrated. And it's going to bring a lot of problem. Health information, sharing health information is part of the role of the renewable energy. I hope that you are getting it as we go along. So we have been talking all day about the access to energy, what energy, why we need energy in the health system, what energy can do to us, how it affects our health. But what are some of the barriers to access to energy? We have insufficient data to support energy decisions. Those who are to make the decisions for us, we don't feed them back with the data because they don't live with the reality. I was very happy with the contribution from my sister who said, you don't sit and make decisions for people, you go and live with them to feel the reality. It's only when you sit back and feel what the people feel, understand what they feel, then can you bring back this data. But most of the time, the decision about energies are being made in 6-star hotels very far away from the people that really need this energy. Communication lack. Communities lack access to remote areas. There are some areas where even when you put the grid, when you use the grid, some people cannot connect to it. It means that if we have a solar system here and somebody that is like 2 kilometers cannot connect, and because we don't have the finances, the person cannot connect. So if you have a health center in that place, they are still not going to have access to energy. So barriers to energy need to be overcome with a combination of technology, talent, and tenacity. It's not just going to be about talking. We need to develop our own technology. We don't need to wait for somebody that comes to give us. We need to build our talent. We need to build our own resilience. We should not only sit and wait. We should be able to do something. We need to, like, one of the reasons why youth are here today is to network. We need to bring our best practices In Kenya, there are hospitals that have been able to use renewable energy. It has even reduced the cost for patients. We need to transfer that energy to other African countries. We need to link. Why are we having this air pollution? It is because we are using in Douala, where I live in Dokoti. When you pass there, you see people cooking by the roadside. You see people trying to pick from the waste bins. You see very old buses trying to transport people. All of that reduces, it emits black carbon into the air, and this black carbon mixed with particulate matters. Particulate matter is so fine that when you breathe in this type of air, it goes right to the deep tissues, and that's why sometimes we are having some disease conditions like lung cancers, and the patient will tell that I've never smoked, and you are like, is that really true? It is because of climate change. So we need to have energy that is clean so that we remain healthy. We also need to diversify our supplies. We are not supposed to get energy only from solar, hydro. We have to have diverse supplies. If the finances were there, a health system can have multiple sources of energy so that if one is not working, we can switch to the other. Renewable energy is going to create economic development and job opportunities. That one, Prof dwells very well on it, so we don't need to labor on that. So the role of policy and investment in promoting energy. We talked about the government. We know we are all from Africa. It's almost the same story everywhere. With international organizations, when Mr. Eugene was presenting yesterday, he talked about the complex going to keep his money. If he knows that by keeping his money and living in the same country, in the same political environment, he's going to have diseases that might not get a cure. They might want to invest. So we need to bring the private sector into it. Investment policies for energy transition include general policies and strategies aimed at achieving emission reduction. Now, sometimes, even when we are talking about renewable energy, we really need to look at if this energy is very clean. Because even some of the gadgets that we use still emit some emission. So we need to make sure that we have people that look into these policies to see if it is actually clean, if everything about it is clean. You heard Prof when he was talking, he said that some of the oils that they generate, they don't even want to use it because they need to be refined further. This is what we are talking about here. So promoting renewable energy policies and standards can encourage the development and adoption of renewable energy sources such as solar and geothermal, limiting greenhouse gas effects. Everything is about limiting greenhouse gas effects. It's about reducing the global warming, because we have climate crisis because of emissions. And that's why in Africa we are beginning to have heat waves, we are beginning to have floods, droughts that we never used to have before. Slide, please. So, looking at it in whole, what are the steps that we can take to access energy for a resilient health service? The first one is advocacy. When I was talking about policies, I told you that most of the time, even the rich person that does not want to invest in energy is because he does not know, he's not aware. So as youth, we should advocate at all levels, local level, national level, and internationally, so that people should know that it's actually a problem. Our health are being affected by dirty energy. Government policies, they need to look at it very well. We should not just come and deceive people that there's energy, like you see the grid. Some areas are well lighted, whereas others have no access to energy. Financial mobilization. When I was talking about the pillars of resilient health system, I talked about health finance. How is this money allocated? Who looks at it? We need to talk about technology. We need to put all of this together to have access to energy. So if we do all of this, we'll have access to renewable energy. I would like to conclude by saying that energy is a live wire of the health system. Without energy, healthcare delivery cannot be given. The energy to the hospital or to the healthcare system.
Morning. One from a professor, and then the second from a specialist working around health and climate change. And I want to believe you have questions. So we're going to be taking 3 questions so that we can save time. So I'll make it 4, 2 per agenda. So I would go with Shakri, 1, who would represent the advanced age. And then the lady, I already picked this table, apologists would come back 2, 1, 2, 3, Fatu 4. So please, you have just 1 minute straight to the question. No need to explain. Doctor will be available to. So Shakri, please go ahead. You can use the mic on your table.
Alors, merci, docteur, pour la présentation. C'est très intéressante. C'est un sujet très important, question de relations santé, climat, énergie renouvelable. Mais il y a un grand problème, surtout pour financer cette partie de finance, climat relative à la santé, parce qu'on n'a pas de data, on n'a pas de données. On ne peut pas financer quelque chose sur lequel on n'a pas de données. Est-ce que vraiment il y a un effort pour estimer ce coût? Parce que parfois ce coût, il est physique, mais il est aussi mental. Donc c'est ça ma question et merci.
Thank you, Chakri. So 2, the lady. 1 minute.
Merci beaucoup pour la présentation. Moi, c'est Sawadro Audrey du Burkina Faso. Au Burkina, les travaux champêtres et les produits chimiques sont plus utilisés par les femmes. Et à ce niveau, en tant qu'acteurs de la société civile, nous les accompagnons à faire la promotion de l'agriculture durable. Et pour cela, nous les montrons comment faire du compost, de biofertilisants. Et aussi, nous faisons la vulgarisation des foyers améliorés qui protègent la santé des populations, surtout des femmes qui utilisent plus ces foyers. Maintenant, ma question, je voulais savoir au niveau du Cameroun, si vous pouvez nous éclairer ou nous orienter par rapport à tout ce que vous faites pour la protection de la santé de la femme au niveau local. Parce que le professeur avait montré un peu des innovations et je voulais vraiment savoir au niveau local qu'est-ce qui est concrètement fait pour qu'au niveau du Burkina, nous pouvons avoir aussi de l'expérience pour pouvoir divulguer et partager cela. Merci.
Merci. Number 3, yes, go ahead.
Thank you very much for the presentation. I have a simple question. I would like to know how can policy frameworks efficiently contribute to the adoption of renewable energy? I'm asking this question because from my little experience I have, especially in my country, we have noted that we have very beautiful policy frameworks, but when it comes to implementation, it's really a great challenge. So I want to understand how these policy frameworks can efficiently contribute to the adoption of renewable energy. Thank you.
Thank you. Efficient policy framework implementation. So Fatu, last person, go ahead. 1 minute.
All right, thank you. I think we have seen the importance of clean energy in all sectors. So I want to know, how can renewable energy be used in the health sector to improve mental health?
Thank you. A smart guy. You stole the time from me. I was actually calling Fatu, but I think you've passed your question and Doctor had captured that. So Fatu, please go ahead.
Bonjour à tous. Je suis Fatoumata du Burkina Faso.
Je vais déjà pour remercier la présentatrice pour les riches données qu'elle a partagées avec nous. Mais vous conviendrez avec moi qu'en Afrique, nous avons une seule chose en commun qui est le soleil, qui nous bronze à longueur de journée, mais qui n'est pas du tout exploité. Et pourtant, nous remarquons que dans nos centres de santé, nous sommes vraiment en manque d'énergie conventionnelle, mais surtout dans nos zones rurales où l'électricité conventionnelle n'est pas du tout reçue par tous. Alors aujourd'hui, moi, je ne vais pas poser ma question directement à la présentatrice, mais plutôt au professeur qui a fait sa présentation ici, qui nous a montré plusieurs innovations qu'il a eu à réaliser et que nous devrons être à mesure d'exploiter cela. Alors, je vais vers le professeur qui est encore ici présent, c'est une chance. S'il peut nous dire, est-ce qu'il y a une possibilité de créer des batteries africaines qui pourraient être utilisées par les Africains? Question de réduire les coûts de ces batteries qui sont extrêmement chères. Aujourd'hui, nous avons besoin d'énergie solaire afin de décentraliser ces questions-là. Alors, nous disposons du lithium, nous disposons du cobalt qui est là en Afrique, mais nous ne l'exploitons pas. Est-ce que nous avons la possibilité de produire ces batteries-là qui sont extrêmement chères au profit des Africains? Merci.
Merci, Fatou. Doctor, you have the mic to respond to this concerns from participants.
Thank you very much for the questions. The questions show that you were following. The first question, is there any estimation in terms of costs, that is both financial and mental? When we talk about cost, sometimes we are carried away to look only at the financial aspect of it. But in my presentation, if you're listening very keenly, I said that one of the pillars of a resilient health system is the workforce. And I made mention of the fact that the person who is supposed to deliver the services, if the person is not stable, maybe because he had a heat wave and could not sleep very well, he will not be able to deliver the cost. That is one aspect of the cost, which is even bigger than what we need to invest. Because if you look at those who have been able to have solar panels working very well, they put in a certain cost, and the long-term effect is cheaper even compared to the hydroelectricity that we pay for. So in evaluating the cost, it's very important to look at the mental aspect, which is not the finance. I hope I answered your question. The second question is about women in agriculture. You know, mental health is very gender sensitive. And women in agriculture and what is done to protect the health of women. In Cameroon, Acess is doing the biofertilizer project. This is because the cultural practice here in Cameroon, especially in the northwest part of Cameroon, is to burn grass to make the soil very fertile. So advocacy is already done in that part, involving the women to be able to understand that to be burning grass, it's not healthy for them. It's destroying the soil. So we now teach them to adopt biofertilizers, which keeps them healthier. Now, I have a group of doctors I'm working with because climate change and health is still very remote in most parts of Africa. And people are not even aware of the effects of climate and health. Now, we tend to educate patients on even how to eat, because what you eat matters. Africans have been trained to eat very refined food, which is not healthy. And you agree with me that it is the women that take the decision on which type of food they cook. So we give them this education so that they themselves stay healthy. You eat food that it's more climate sensitive, more vegetables, more fruits, more water, instead of eating very refined food. Also, we are teaching people now to consume a lot of fruits with vitamin C and E, which are antioxidants that will keep you very healthy. Most of that education, we give it even in the antenatal clinics when women come to book. We have talked about much policy framework, but no implementation. I think that when the Ambassador Oseni was talking yesterday, he said he needed somebody that was going to replace him. And that's why this is a youth conference. Because we are here to be able to look at what is not working correctly so that we fit into it. My take on this matter is not even just training youth at this level on climate change and the challenges. It's to go right to the lower level. Let the next generation know what the problem is. We should not come here and sit down and deceive ourselves. And this youth, you are not only going to be doing climate change, you might also enter the seat of politics so that you are in the decision-making board. If we only sit down here and talk about climate change and we don't aspire to get into those positions, and then we are not going to change anything. When we talk about advocacy, we want to go and tell those who want to make decisions so that they know. But if you know, if you are a youth and you already know, and you are a politician tomorrow, you are going to make the policy to favor climate change. How can renewable energy be used to improve mental health? It's not only renewable energy that can be used to improve mental health. Mental health is a very broad scope. It ranges from post-traumatic stress disorder to schizophrenia, if I just want to put it like that. The terms might be sounding very big, but they are very simple things. There are things that we see over and over again, and our brains record them. And over time now, we can begin to express them, and that is what we diagnose as mental health. Now, wildfires, let me just take the example of a flood. A flood occurred, and maybe somebody suffocated and was taken to the hospital and nothing was done because there was no energy. That is a traumatic disorder. Eventually, somebody who has lived that is going to manifest other mental health issues. So, from the etiologic part of it to diagnosis and management, mental health is involved. Because it is actually the flood that caused that traumatic stress. Now, the person going to the hospital and was not given care amplifies the stress. So you can see how renewable energy can affect mental health at all levels, from the etiology to the diagnosis and the management. Looking at it from the other perspective, if the healthcare provider is not stable, he will miss a diagnosis of mental health, and it compounds the mental health issue. So renewable energy is very important in mental health. Thank you.
Thank you, Doctor, for the response. And I think in Doctor's response, there were a couple of opportunities that she was also throwing out, areas of engagement for young people in this hall. I see that a couple of you still have me at heart. I will just give one more person the opportunity, 2 minutes, so that I can leave here in good spirit.
Enfin.
Go ahead.
Merci pour la parole donnée. Chaleureuse salutations à toutes et à tous. Je réponds au nom de Ursula Sa, ingénieure en énergie renouvelable. Donc voilà, je vais revenir sur ce que M. Saïd Chakri a dit hier. Il a dit l'énergie renouvelable est là, mais on devrait parler de l'accès. Comment avoir accès à cela? Tout à l'heure, la dame a parlé de la sensibilisation, de l'éducation. C'est une très bonne chose, mais je suis certaine que beaucoup d'entre nous connaissent ici le bien fondé des énergies renouvelables. Combien ici on utilise? On connaît tous les impacts de la déforestation, son impact sur les effets du changement climatique et tout. Combien de personnes ici utilisent des énergies propres pour la cuisson, comme du charbon écologique et autres? Lorsqu'on va parler du développement durable, les 3 piliers sont indissociables, on va dire ça comme ça. Mais on a l'impression de beaucoup plus s'appuyer sur la partie environnement. Où est l'économie? Sans mettre l'accent sur la partie économique, on ne peut pas vraiment réaliser tout ce qui rentre dans l'environnement. Je vais prendre un exemple. Nous sommes une organisation, on travaille dans la mangrove avec les populations. À Manoka particulièrement, l'activité principale, c'est la pêche. On pêche, les femmes vont fumer du poisson. Où est-ce qu'elles vont couper du bois? Les palétuviers dans la mangrove. Il y a une très bonne partie de cette mangrove qui a disparu parce qu'on coupe les arbres qui servent de barrière, l'érosion se crée, l'eau vient prendre de l'espace. Qu'est-ce qu'elles vont faire? Avec les ONG, on s'est dit, bon voilà, il y a les foyers améliorés. On a proposé ces foyers améliorés. C'est une très bonne chose pour la préservation de cet environnement. On a implémenté le projet, les femmes ont utilisé sur une très courte période, moins d'1 mois, et ont abandonné. Pourquoi? Parce que les foyers améliorés avaient une capacité de production de fumage de poisson très faible. Qu'est-ce qu'elles ont fait? Elles sont revenues sur les anciens fumoirs. Qu'est-ce qu'on va dire? Qu'elles sont dans la criminalité environnementale? Non. Elles ont raison de le faire. Pourquoi? Parce que... Ah, je suis très rapide. Ah, sorry. Désolée, pardon. Ok. Désolée. Ok. Ok. J'étais en train de dire que... Nous travaillons dans les mangroves avec les populations locales, plus précisément à Manoka. Bon, j'espère que la fréquence est bonne comme ça. On travaille à Manoka et l'activité principale à Manoka, c'est la pêche. Les hommes vont à la pêche, les femmes font du fumage du poisson. Plus la pêche est importante, plus la quantité du bois de mangrove coupé est importante. Et c'est vraiment l'activité principale. Qu'est-ce qu'on a fait? On s'est rendu compte que la mangrove était en train de disparaître à cause de l'érosion, cette érosion-là qui est due à la coupe du bois. Qu'est-ce qu'on a fait? On a proposé des foyers améliorés à cette population-là, qu'il a utilisé pour une très courte période, parce que la capacité de production du fumage de ce poisson était faible. Là maintenant, on ne va pas tirer sur ces populations parce qu'il y a l'aspect économique. Tout à l'heure, on a parlé de la santé, on a parlé de ce qu'on pouvait manger. Beaucoup de personnes ici savent où est-ce qu'on vend les produits bio. Mais qu'est-ce qu'on fait? On se dit, on n'a pas les moyens de le faire. Donc, il y a cette partie économique. Je me dis qu'aujourd'hui, au lieu de dire que non, on devrait se battre pour préserver environnement, on devrait rester dans la logique du développement durable. Se dire, ok, est-ce qu'il y a vraiment équilibre? Est-ce qu'on est en train de penser à la partie économique? Parce que là, nous sommes un peu trop dans l'abstrait. Il n'y a pas de concret. Tout à l'heure, vous avez parlé comme solution, vous avez dit, il faut faire des plaidoyers. Il faut aussi demander des financements. Depuis quand est-ce qu'on fait des plaidoyers? Ce n'est pas une première conférence. Il y en a eu plusieurs. Depuis quand est-ce qu'on fait des plaidoyers? Depuis beaucoup de temps. En ce qui concerne les financements, on sait que oui, on est responsable à moins de 4% des émissions globales. Les autres savent que ce sont des responsables. Mais ce qu'ils doivent donner comme financement est non contraignant. Rien n'oblige ces personnes à nous donner quoi que ce soit. C'est la raison pour laquelle on devra toujours rester la main qui demande et la main qui demande et la main qui reste en bas. Donc, ce sera toujours comme ça. Donc, je me dis, essayons de mettre l'accent sur la partie économique si on veut vraiment atteindre un jour cette transition écologique. Parce que ce que moi j'aime souvent dire, c'est que la transition écologique doit aller en droite ligne avec la croissance économique. Les deux doivent aller de pair. On ne doit pas simplement dire transition écologique et oublier la croissance économique. Donc voilà, comment avoir accès à cette énergie? Jusque-là, la question reste. Comment avoir accès? Je sais que l'énergie renouvelable est bien. Je suis ingénieur en énergie renouvelable. Je sais que c'est bien. Moi, je n'ai pas de panneau chez moi. Je vais dire que je peux utiliser du charbon écologique parce que nous en produisons. Mais pour le reste, qu'est-ce qu'on fait? Merci.
Thank you. Thank you for that question, which was more of a comment before the question. And the same thing keeps coming up. Why are we here? We are for more than double adaptation finance. Am I correct? Yes. Yesterday, one of the speakers said that we should not wait for money that is coming from somewhere. We should start looking for our own means of generating money. Just like you said, the hand that asks, the hand that receives is always under. So as Africans, what can we do? We can make groups, we can build small groups, finance groups, to be able to generate money, to be able to save and generate the money to start small projects and then scale up. Instead of just waiting for money that we have it in our brains and our minds, and the money is not coming on the table. Thank you.
So at some point, I was almost thinking she was giving a presentation, but also this shows the passion that young people also put to want to contribute meaningfully to conversations as critical as this. Mental health is affecting young people, their inability to secure jobs, occasioned by the impact of climate change. And you can see how passionate our sister, even though I'm still learning French. My French would improve when you see me next year. So we've made progress, 2 sessions presentation so far, focusing on renewable energy, energy access, energy democracy. We're taking it further. Before we move, I want all of us, our hands like this. Yes. Thank you. It's just for 2 minutes. The reason why I want our hands this way is so that nobody will pick up their badge and look at the question I want to ask. What's the theme for this year's Yofafa? Okay, means we are following the conversation. So put your hands together for yourself. Because I thought I was almost going to look at the team. So for those who don't know, that's the team. We're moving straight to the next session. The next session is going to take us further to the session we had online. We converged for 4 weeks, those of us from outside of Cameroon. I was following the conversation as well. I was part of those. And then the questions as well, we asked. A lot of us had concerns. Some said it was enriching and so forth. So we're taking that further. We'll be having a breakout session now. There are issues around climate finance. Young people say they don't have access. There are no dedicated funds. We saw the gaps in adaptation finance. I don't know how many of us know what funds are available. I'll just read a few before we go. So there is the Adaptation Fund. There is the Global Climate Change Alliance, GCCA. There is the Least Developed Countries Fund, LDCF. There's the Millennium Development Goals Achievement Funds, Pilot Program for Climate Resilience, PPCR, Special Climate Change Fund, SCCF. There's the Strategic Priority on Adaptation, SPA, and the most popular of them all is which one? GCF. Thank you. And we know that some of these funds have to pass through national NDAs, they call them. Sometimes it could be difficult to assess even as young people. But the next session we are going to have is going to be a working group, and we are looking at proposal development, working group on GCF funding proposal. First of all, I'll kindly want to ask if you know that you are in this hall and you participated online. Can you please kindly stand up? You followed this session online, by extension, an international participant. Please, can you stand? I'm not asking you questions, don't be scared. So while we're trying to do this, I think we'll have Prosper also give us some quiet interludes on the background. Prosper, if you're ready. Please, international students, stand. I myself am one of, we're supposed to have about 30 or so. Sorry? Oh, French. I think the translators are also helping us with that. I'm saying if you're an international participant, you followed the 4 weeks training online, please kindly stand. So we're going to pick numbers, right? It's 1 to 5. So I'll go table by table. If you pick 1, 2, we continue 3, 4. Oh, okay. So I've been asked that we also do the English and French thing. French by my left, English by my right. This is my left. So this table will demarcate us. French this way, English that way. You want collabo? We can do the English and French first. Thank you. Let's use 2 minutes for this. French this way, English. Yes, where Sylvia is. We are young people, we should be smart and fast. So I need to see a demarcation here. This is the boundary. So we have French this way, we have English the other way, where you have Sylvia and Sabrina. This is in order to aid conversation so that the conversation can be free and we can flow and be able to share ideas. If you are bilingual, you can choose any of the side you think you are comfortable with. English, French.
Tous ceux qui viennent de l'international et parlent français, là, pardon, par ici.
Oh, merci. So we have French here, yeah? So English, please, can I see you stand, please? International participant here. So you can stand. Yes, stand. So you're also going to take numbers. Yes, guys, one house, please. One house. So I'm giving a brief intro. We are going into groups now, right? Can we have one house, please? The Anglophone guys, can we have one house? Well, you guys would have allowed me explain further. You're not just going to stay all by yourself. So stand. Thank you. So we're going to pick numbers 1 to 5. Right? Same thing for the Francophone guys. We are going to pick numbers 1 to 5. So we start with the English guys. 1 to 5. 1. Who is taking 1? Fatima, you're 1. 2, Sabrina. 3, 4. 1. 2. I'm going to be 3. So for this guys. Oh, okay, yes. 4, 5. Prosper, you're 4, you're 5. We're joining the group when we're done. Yes, so for the 1. Okay. Uh-huh. Are we starting again? We're good? Yes, a reintroduction. This exercise is for all of us. However, we want to identify the international participant that followed the 4 weeks training online. And I believe that's what we have here and over there. And we're good with the numbers, yeah? We're good with the numbers? So everybody has 1 to 5. Thank you. Now, the number you have picked is going to be the group we'll be working with. So we'll be having 5 groups, right? We'll be having 5 groups, and this group will be a mixture of both the international participants and our colleagues, our hosts in Cameroon. So we would also have, we are sorted with this, so please you can stand and also get numbers. Thank you for your cooperation. National participant, please stand. National participant, please stand while we have the international seats. We have to be snappy because we are racing against time. Good. So I'm going to go roll by roll. So I'm starting with this roll. You pick a number, 1 to 5, and then we just continue. So we're starting with you. 1, so move. No, 2. Next table. English.
Pardon, en fait, bon, je ne sais pas s'il va vous scinder ou pas, parce qu'il y a parmi vous certains qui ne comprennent pas l'anglais, il va vous troubler un peu. Donc, carrément, on fait French par là, English par là.
Can I get... Oh, okay. Thank you. Thank you so much. My attention has been drawn. My assumption was wrong. I felt all the nationals speak French. Great. Thank you for that clarity. I appreciate. So, French nationals, French-speaking nationals, this way. English-speaking nationals, by my right. Snappy, please. They stand that way and pick their numbers. Yes. Can we be fast as young people? French-speaking nationals just behind the international guys. English. Yes, you can still stand, please, because we're picking numbers. Great. Yes, so pick numbers, please. You can come with your bags to wherever you're coming to, yes. Yes, let them start, please. The English nationals, are you ready? Yes, let's go. Numbers, please. Which next? 2. Okay, the next table. Let's go, yeah? All right. Next table. Yes? All right. Uh-huh. Perfect. We're done, yeah? So back to the French-speaking nationals. Pick your numbers. Okay, thank you. Thank you. So you can sit. Now, I would like all the ones, right? Listen carefully now. So we have, can we sit and have one house? Wherever you can find sit, just sit. So we have 5 groups. We have 5 groups for the French speaking, 5 groups for the English speaking. So this table is going to be for group 1, for French. Yes, yes, we have them. They have. We have a translator there. Yes. If you have your headset, you can wear so that we have seamless communication. So this table is going to be for group 1, for the French speaking. The next table, group 2, for the French speaking. The next table, group 3, for the French speaking. We have group 4, and then the last table is group 5. So each table should have 5 persons per table. Can we be fast about it? Group 1, group 2, 3, 4, the last table, group 5. For the French speaking. Yes. For the English speaking, for our colleagues, so whether you are international, whether you are, we have to mix, please. Excuse me, on each table, on each group, we would have 2 international participants on each group. So group 1, made up of 5 persons, 2 of the 5 would be from the international participants, right? Then the remaining 3 are going to be our national host. For the English speaking, this is going to be group 1. This table, group 1. So all the ones, we might have an overflow, right? So we can have an extension. Same thing apply for this English speaking group. Each group would have 2 international participants and 3 national participants. 5 per group. Huh? Or do we have more? Can the table accommodate more? Right? So this is group 1. The next table is group 2. Right? The table after the next is group 3. Group 4. And then the last table, group 5. Let's be snappy. Group 1, group 2, group 3, and then group 4, then the last table is group 5. Yes, thank you. Are we settled now? Great. We have approximately 30 minutes to run through this session. So we have to pay one house, please. Thank you. We have approximately 30 minutes to run through this session. So we have to be as fast, effective as possible. While I call on the lead facilitator from Sustainable Solution for Africa, Mr. Koda Kujo, and his colleague, Mr. Eddie Lantome, to join me. We'll listen to the two prospers give us a short interlude. 2 minutes.
Hello, everybody. Okay, a short practice from last time. Adaptation finance. Adaptation finance. All right. Do you remember the song we sang last time? Okay, okay. I am Prosper and he is Prosper too, so yes. And he is Michel. So we be like, what could be more urgent when the future is at stake? What amount is too high for the lives at risk? Yes, we are African youth calling for grant-based funding. We say more than double adaptation. Let's go together. More than plus que le double, maïs que le double, plus que le double, maïs. Plus que le double, plus que le double, maïs. More than double, adaptation. Sing it like you mean it, more than double. Plus que maïs que au dobro. Okay, Prosper has something to sing.
It's about justice. I won't keep quiet. It's about justice. I speak
It's
up.
about justice.
It's about justice.
I won't keep quiet.
I won't keep quiet. It's about justice.
I'll speak up.
I speak up.
It's about
Thank you.
justice. It's about justice.
Thank you. It's about justice, and each and every one of you won't keep quiet. Thank you, Prosper. Thank you, Tapiwa, for that. We'll have time for more of that. So I've brought to the stage the two lead facilitator who will further give us instructions, and then we'll move straight ahead. So, Mr. Kojo, you have the...
Okay. Thank you for giving me the floor. I am Koda Kujo from Togo, Sustainable Solution for Africa. So the exercise we are going to do now is, before coming here, like the speaker says, people attended the online session on GCF, how to draft concept notes and others. And now we want to put it in practice. And what we are going to do now is to choose concept notes for each country. We have several countries here. We will go to the GCF sites and choose one concept note and now convert those concept notes in full proposal. So we are here, just here to play the role of facilitators, and we guide you to convert the concept note into full proposal. We know that it is difficult, we will not finish it, it is a hard work, but we start, and if there are some questions, we try to answer the question and your issues. And I think you have access to the platform of UFAFA. We have the exercise there, the working group, the TOR, and you have to download it and follow the instruction there. So we are two. I am with my colleague Eddie. Eddie will work with French group, and I will also try to be with English people. So thank you. You say?
Yes, so Eddie is working with the French group, and then Kojo with the English-speaking group. Let's be sure that you all have access to the training platform, your favorite platform. I'm aware a couple of us have also downloaded some of these materials. So for each table or each group that has the tool downloaded, kindly bring them up so it will be easier for us. We just have 15 minutes to run through this. It's a difficult process, but we're starting, and hopefully we can get feedback before the end of tomorrow, right? So we move now. So yes, we are starting now. Thank you. Yeah, okay.